Hello and welcome to this segment of this in-service presentation, which is on the symptoms of Parkinson's disease. Parkinson's has 4 primary symptoms: tremor, rigidity, akinesia or bradykinesia, and postural instability. The acronym TRAP is a good way to remember these symptoms, which I will now go over in more detail. Tremor is a repetitive shaking, sometimes referred to as a pill-rolling tremor. It usually starts in the hand, and it's socially distressing but not life-threatening. Tremor is observed when a body part is completely at rest, and it subsides with action or the assumption of a posture. The onset of tremor is typically asymmetrical in one hand, but it can be elsewhere. Early in the disease, tremor may be intermittent and may be precipitated by anxiety or stress. Some people with Parkinson's, though, do not have tremor and present more with akinesia and bradykinesia. Tremor may not respond as well to treatment as the symptoms of stiffness and slowness. And despite treatment, most patients will continue to experience some tremor. Day-to-day activities can become difficult if tremor is significant, and so we recommend referral to an occupational therapist for assessment and recommendations of assistive devices. Tremor can affect many areas of the body, including the hands, the feet, and the jaw, and it can also be felt as internal tremor. Voice and head tremor, however, are more likely associated with essential tremor, which is a separate condition. The symptom of rigidity is the most serious symptom of Parkinson's, but fortunately it responds well to treatment. It causes stiffness and inflexibility of the limbs, neck, and trunk, and it's detected by slow, passive range of motion. Muscle tone of an affected limb is always stiff and does not relax, sometimes contributing to decreased range of motion. People with Parkinson's most commonly experience tightness of their neck, shoulder, and leg. Rigidity affects all muscles and is experienced as stiffness of the arms or legs beyond what would normally result from aging or arthritic changes. Rigidity can also affect the trunk, and speed of movement is slowed. This affects the ability to accomplish daily activities. Rigidity makes it difficult to move well, and it's a risk factor for falls. The symptom of akinesia, bradykinesia, relate to speed of movement. Akinesia is the absence of movement, while bradykinesia is slowness. Bradykinesia is what is seen at the time of diagnosis, whereas only when a Parkinson's is quite advanced does the person become akinetic. Bradykinesia is a defining feature of Parkinson's, and it results in difficulty beginning and continuing a movement, or difficulty producing rapid, alternating movements. Bradykinesia also describes a general reduction of spontaneous movement and difficulty with repetitive movements, such as finger tapping. Due to bradykinesia, people with Parkinson's may have difficulty with everyday functions, such as buttoning a shirt, eating food, or brushing their teeth. People who experience bradykinesia may walk with short, shuffling steps, and the reduction in movement and limited range of movement can affect speech, which may become quieter and less distinct as Parkinson's progresses. An important thing to remember is that this symptom applies to autonomic responses, and it's a common cause of constipation. Fortunately, however, bradykinesia responds quite well to medication. Akinesia and bradykinesia, as well as rigidity, are the primary symptoms most responsive to treatment. The next symptom is postural instability, which is one of the most important symptoms of Parkinson's. This is a tendency to be unstable when standing upright, and a person with postural instability has lost some of the reflexes needed for maintaining an upright posture. The person may topple backwards if shaken even slightly, and some people develop a dangerous tendency to sway backwards when rising from a chair, standing, or turning. This problem is called Rhett Repulsion, and it may result in a backwards fall. Postural instability causes difficulty making turns or quick movements, and it can lead to falls. And falls are a common reason for hospitalization and mortality in Parkinson's. Postural instability typically occurs once Parkinson's has advanced. If this symptom occurs early on, it's usually an indicator that the person has atypical Parkinson's, such as progressive supranuclear palsy, PSP, or MSA, which is multiple systems atrophy. Combined with stooped posture and shuffling gait, postural instability can lead to falls, and unfortunately, it doesn't respond well to medication. If a person with Parkinson's is having difficulty with balance, we suggest that they must get a physiotherapy assessment. The cardinal symptoms of Parkinson's are the tip of the iceberg, and there are additional motor and non-motor symptoms that often have the greatest impact for patients. These include small handwriting, which is common before or at the time of diagnosis, and this is handwriting that starts off normally and trails off. Lack of fine motor control, lack of facial expression, which is sometimes referred to as the Parkinson's mask, soft and sometimes unintelligible speech, low blood pressure, constipation and urinary frequency, erectile dysfunction, pain and cramping, and finally, although not common, sweating can be a symptom of Parkinson's. Other people may feel cold on the hottest of days, and this is because the temperature regulating area of the brain does not function properly. With respect to facial expression, lack of facial expression may make the person look depressed or apathetic. And given that we're social beings and we react to nonverbal cues, it's important not to assume that the person is disinterested or sad and to ask them how they're feeling. With respect to pain and cramping, this particularly affects the muscles in the neck, shoulder, and calves. Drug treatment can be very effective, especially when combined with regular stretching and exercise. There are additional symptoms of Parkinson's, and these include fatigue, sleep disturbance, mood disorders such as anxiety, apathy, and depression, deterioration in memory and thinking, lability, and oily or dry, scaly skin. Fatigue is poorly understood, and it appears unrelated to the duration of Parkinson's, the severity of motor function, medications, or sleep disturbance. It is strongly influenced by the presence of anxiety and depression and worsening physical status, and so many people with Parkinson's take a rest during the day to combat the fatigue. Sleep problems include insomnia, daytime sleepiness, problems getting to sleep or staying asleep, and this is often due to excessive motor activity at night, such as their legs jerking spontaneously. Sleep problems also include vivid dreams or nocturnal hallucinations. REM, sleep behavior disorder, is common in Parkinson's, and this is vigorous behavior during REM sleep. The usual loss of muscle tone in REM sleep doesn't occur for someone with Parkinson's. People may call out or strike their bed partner, and some people have fallen out of bed and hit their heads, so this is a very serious symptom and it must be mentioned to the person's doctor. With respect to lability, the person may tear up easily and sometimes inappropriately. And with respect to oily or dry, scaly skin, this is not common, but I mention it because it can occur. That brings us to the end of this section on the symptoms of Parkinson's disease. Thank you for watching. This presentation has been developed by Parkinson's Society British Columbia, and should you like further information, please feel free to contact us. If you are watching this presentation in order, the next segment will cover treatment.